Hello, my name is Ali Tartaglia, and I'm the Director of Student Health Promotion at Bennington College. Given this unique time, I am going to tell you a little bit about the services and programming that are offered in the Student Health Center. The Student Health Center is our integrative health and wellness building, which houses psychological services, health services, and the Office of Student Health Promotion. Health services, under the direction of Dr. Randy Anselmo, functions very much like a family medical practice. Dr. Randy is able to offer wellness checkups, management for acute and chronic health conditions, coordination of care with home physicians, as well as specialty referrals when they're necessary. We're also able to do some basic laboratory tests on campus, as well as he keeps a stock of regularly used medications to decrease issues related to access for students on campus. Services that are not able to be performed on campus are referred typically to the Southwestern Vermont Medical Center, SVMC, in Bennington. Typically, he uses them for needed laboratory tests, x-rays, emergency care, and specialist consultation. And he works closely with both the hospital and the physicians that are affiliated with it to ensure continuity of care for our students once they return on campus. Psychological services, led by Dr. April Stein, is made up of experienced clinicians with a wide array of diversity related to cultural backgrounds, religion, sexual orientation, as well as the theoretical orientation and the intervention approaches that the different therapists use. The clinical staff includes a psychiatrist and several psychotherapists with backgrounds in social work, counseling, and psychology. They offer a wide array of services also, including diagnostic assessments, individual psychotherapy, medication management, support and skill-based groups, small groups, 24/7 crisis stabilization and emergency support during term, referrals, outreach program and training, is also provided to students, faculty, and staff, as well as psychiatric consultations. Services for both health services and psychological services are billed through insurance. As you know, all of our students are required to have insurance upon registering. We encourage families to talk with their students about what is and isn't covered under their individual insurance policies. But we do also offer insurance counseling on site if students require that. We also understand that not every policy is inclusive of the services that we offer. So in our effort to ensure that students have as much access as they need or want, we have an appeal process that goes through our business office where students are able to ask for reduced or free services given their ability to pay. The other office that is in our Student Health Center is the Office of Student Health Promotion, led by myself, Dr. Ali Tartaglia. And our office really works on the prevention and education programming on campus for our students. That covers a wide array of topics, everything from stress management to sex education to tobacco cessation to sleep hygiene. We employ several students that work for us that help us with our messaging to ensure that it's spot on in terms of what our students are looking for. We provide that education in a multitude of different ways. We do events, we do educational workshops, we do one-on-one behavioral counseling, skills-based. We work very collaboratively with psych services to ensure that the small groups that are offered hit the different topics that students are looking for, and typically either have myself or a therapist or both at the small groups. I also function as a confidential resource on campus for students who experience an issue of sexual misconduct. And I'm available for students 24 hours a day, 7 days a week. I'm able to advocate and support them through an administrative process on campus, or should they choose to reach out to a community to go to the police, the hospital, what have you, I'm able to support them through that process. Also, as part of our broader well-being program, I am the manager for our Maya Recreational Barn. This is our fitness facility, and it houses cardio equipment. We have strength training equipment, as well as a free weight room and a climbing wall. The barn is a place where we typically employ many students on campus, and they are trained to be able to talk with their peers about positive behavior changes that they've made, as well as help connect them to resources should they need additional assistance. We typically offer both yoga and meditation classes that are free of charge to students on campus. We strive really to create a collaborative environment and an integrative environment between all three offices within the Student Health Center. Given that it is a small school and we're dealing with a smaller amount of staff, we're typically able to ensure immediate connection for students who are seeking additional support. So, for example, if there is a student that comes to see Randy for a health visit and asks about smoking cessation, Randy is able to connect them with me pretty much immediately. Additionally, I'm able to take a student that's coming to me to talk about stress management that perhaps needs more, it requires to see one of the therapists. I'm able to work on getting them in relatively soon to see one of the therapists. That is one of the nice things about being at a small school, and to have the directors of the health center working so collaboratively together. We also, because of that environment, are able to work collaboratively on a lot of the topics that are important to all of us. So, for example, right now, the three directors are working on our JED Campus program together. JED Campus is a national program that allows us to really look at emotional well-being of our students from a very, very broad place. This is a program that is allowing us to bring together stakeholders from all over the institution to really look at each aspect of what we're doing and how that impacts a student's well-being, and to come up with solutions in ways that we can decrease issues related to access, take more of a preventative approach when it comes to helping to increase student well-being. And this is just kind of indicative of the way in which we do a lot of the well-being program. We're always looking for ways that we can connect with each other and really try to come up with unified messaging as well as services for students in terms of the health center generally. What I'm going to do right now is share my screen with you. And my screen will have the contact information for Dr. Anselmo, Randy, Dr. Stein, April, and myself. If you have any questions at all regarding any of the services that we offer, or specific questions about your student and how their needs may be met, please don't hesitate to reach out to us. We are here to answer your questions, to be a support and a partner in ensuring that your students thrive when they're here on campus. And even in these odd moments where we are not able to be all together, we are looking for ways that we can create an environment where our students are supported, and know that they're supported. Currently, we're doing virtual groups. These were groups we typically did that were small groups that were done on campus all the time. We're doing them now virtually to ensure that students stay connected, feel supported, and know that we're still here for them. So again, let me just make sure I do this right. Here is the contact information for all three of us. Again, please don't hesitate to reach out to us. And I hope that this answered some of your questions about programming on campus and kind of what we do. Great. I hope that you have an excellent time in your virtual look into Bennington College.